Hello, welcome to the Evexia Diagnostics video series on ready-to-run Evexia panels. This is part 2 and will cover an overview of thyroid panels. Now, the presenter for today's topic, the Director of Clinical Support and Education, Dr. Wayne Sedano.
Hi, this is Dr. Sedano, the Director of Clinical Support and Education at Evexia Diagnostics, and welcome to the Evexia Diagnostics Thyroid Panels Overview. This presentation reviews the analytes included in each panel and their clinical usefulness. I want to start out by saying that it's important to remember that the physiological effects of thyroid hormones is wide-reaching. They're involved in lipid and carbohydrate metabolism, growth and development, the cardiovascular system, and the nervous and reproductive systems. So I want you to keep that in mind. So here's a look at the thyroid panels offered by Evexia Diagnostics. There's the complete thyroid panel, the comprehensive thyroid panel, and the premier thyroid panel. Now, these panels are going to offer an array of biomarkers from the baseline biomarkers to the most advanced biomarkers with a focus on thyroid function, as well as including the basic test and panels such as the CBC and the comprehensive metabolic panel. So here's an interesting fact. The American Thyroid Association estimates that approximately 20 million Americans have thyroid disease, and approximately 60% of those with thyroid disease are unaware of their condition. Therefore, many individuals with thyroid disorders may remain undiagnosed. And this can be due to the fact that they may be asymptomatic or presenting with nonspecific conditions of thyroid dysfunction. Now, in regard to selecting one of these tests, you want to give consideration to the following areas. First, do you suspect thyroid dysfunction? Second, is thyroid disease present? In other words, does the patient present with a history of thyroid dysfunction or disease? And third, does the patient present with a family history of thyroid dysfunction or disease? Now, some examples of conditions that can be assessed by these panels are going to include hypothyroidism, hyperthyroidism, autoimmune conditions, arrhythmias, infertility, lipid disorders, osteoporosis, fatigue and pituitary disorders, as well as anemia, blood sugar dysregulation, and many other conditions. So, here's a great integrative medicine clinical pearl for you to remember. Now, many experienced integrative medicine clinicians often see overlapping signs and symptoms of metabolic, endocrine, and immunological disorders as they relate to chronic disease. Blood sugar dysregulation, food allergies, thyroid dysfunction, and hormonal imbalances, especially of the adrenal glands, and gastrointestinal and candida, appear to cause many similar symptoms. So I want you to keep that in mind. The other great feature of the thyroid panels and all of Evexia diagnostic panels is that they come with a functional health report. Now, this type of report looks for the early changes in blood chemistry that can indicate the risk or potential presence of many conditions. Some of the benefits and features of the report include optimal and standard reference ranges, a historical comparison of the previous blood test results, and details about each analyte and nutraceutical recommendations. So before reviewing the analytes included in each panel, I want to give you another great clinical pearl to remember, and that is when assessing thyroid dysfunction, the potential contributing factors can include gastrointestinal dysfunction, viruses such as Epstein-Barr virus and cyclomegalovirus, oxidative stress, celiac disease, environmental factors such as endocrine disrupting chemicals and heavy metals, hormonal imbalances, especially of the adrenal glands, and emotional issues. So please keep these factors in mind. So before getting into the details of the Evexia Complete Thyroid Panel, I want you to know that the analytes in this panel are included in the other two panels. So essentially, this panel is the Foundation Thyroid Assessment Panel. So the Evexia Complete Thyroid Panel is going to give you a clear picture of thyroid hormone production and metabolism, as well as an assessment of overall health by including the comprehensive metabolic panel, CBC, the lipid panel, hemoglobin A1C, magnesium levels, the thyroid profile, thyroid antibodies, reverse T3, vitamin D, C-reactive protein, and the urinalysis. And by the way, the thyroid analytes included in the panels include TSH, free thyroxine index, T3 uptake, total T3 and T4, free T3 and T4, reverse T3, and the autoantibodies, thyroglobulin antibody, and thyroperoxidase antibody. So let's start on the top of this list. Now, the complete blood count with differential, that's going to help provide an overall view of general health and screen for a broad scope of diseases and conditions, including anemia and infection. And remember that thyroid dysfunction can be associated with anemia, so it's important to look at the CBC. The comprehensive metabolic panel, as you most likely know, then that's a combination of 14 test or analytes that's going to provide an overview of the health of the body and its metabolism and chemical balance. The CMP can help with the assessment of such conditions as diabetes, kidney disease, and liver disease. Essentially, the CMP aids in determining the level of glucose and regulation, liver function, kidney function, electrolyte balance, calcium, and protein balance. And remember that thyroid function determines the body's metabolic rate, and thyroid dysfunction can cause overall disturbance in the body's metabolism. Next is the CRP, and that is, of course, C-reactive protein. Now, that's an acute phase reactant. It's produced by the liver in response to the presence of inflammatory diseases, infections, and neoplastic diseases. And a progressive increase in the analytes corresponds to an increase in inflammation or injury. Next is the fasting glucose with the hemoglobin A1C. Now, the fasting glucose was picked up on the comprehensive metabolic profile, but the hemoglobin A1C provides significant information about glucose metabolism and whether or not it's abnormal. And it can be an indicator of prediabetes, insulin resistance, or diabetes. So, in looking at the results of the A1C, it's important to remember that this test evaluates the average amount of glucose in the blood over the last 2 or 3 months by measuring the percentage of what's known as glycated hemoglobin in the blood. Now, in regard to the estimated average glucose, here's what you need to know. The estimated average glucose converts the patient's hemoglobin A1C percentage point into the average blood glucose level in the units of measure of milligrams per deciliter, similar to or the same thing as the blood glucose measurement in the comprehensive metabolic panel. Now, similar to the hemoglobin A1C, the estimated average glucose evaluates a patient's overall success at controlling glucose levels and helps the patient understand the monitoring of their long-term treatment. Next is the enzyme lactic dehydrogenase. Now, this enzyme is found in many tissues of the body, especially the heart, the liver, the red blood cells, the kidneys, skeletal muscle, brain, and lungs. So, an elevated level of lactic dehydrogenase is going to be associated with various conditions. Next is a lipid panel. And as you know, lipids are a group of fats and fat-like substances that are important constituents of the cells and a source of energy. Now, the lipid panel measures the level of specific lipids in the blood, and two important lipids, cholesterol and triglyceride. And as you most likely know, two important lipids, cholesterol and triglyceride, are transported in the blood by what's known as lipoproteins. Now, each type of lipoprotein is going to contain a combination of cholesterol, triglyceride, protein, and phospholipid molecules. Now, the particles measured with the lipid panel are classified by their density into the high density lipoproteins, HDL, low density lipoproteins, LDL, and the very low density lipoproteins, VLDL. And as you most likely know, a high level of triglycerides in the blood is associated with an increased risk of developing cardiovascular disease. Next is magnesium. Now, magnesium is involved in virtually every metabolic process occurring in the body, and it's also a component of the blood. It's needed for nerve transmission. It's used as an enzyme cofactor and needed for protein synthesis. So, knowing the status of this nutrient is especially important. And as you most likely know, the trace elements iodine and selenium are closely related to autoimmune thyroiditis and overall thyroid function. But what you may not know is that low serum magnesium is associated with several chronic diseases, including abnormal thyroid function. That's why you want to take a look at this analyte. Next is reverse T3. Now, in the peripheral tissues, the thyroid hormone T4 can be converted into the more metabolically active thyroid hormone T3 or to reverse T3, which does not function as T3. Now, reverse T3 can be elevated in adrenal conditions as well as in other conditions. So if this analyte is increased, it's going to give you a clue that there is some type of abnormal metabolism going on with the conversion of T4 into T3. And as I said earlier, included in this panel are the autoantibodies, thyroglobulin antibody and thyroid peroxidase antibody, which are used to determine the presence of thyroid autoimmune disease. And as you most likely know, thyroid stimulating hormone that's produced by the pituitary gland and it controls thyroid gland function. Now, TSH, what it does, it stimulates the thyroid by binding to a receptor on the gland called a TSH receptor. and that will cause the release and stimulation of T4 and T3, the thyroid hormones. Now, when the thyroid hormone levels decrease in the blood, the pituitary glands produces more TSH, and that's going to stimulate the thyroid to produce and release more T4 and T3. When the thyroid hormone levels increase in the blood, the pituitary gland is going to produce less TSH, and therefore the thyroid produces and releases less T4 and T3. Now, some of the conditions associated with an increase in thyroid stimulating hormone are going to include such conditions as primary hypothyroidism, could be renal disease. It could be from a recovery of an acute illness. There could be an iodine deficiency. Now, with a decrease in TSH, now that's going to be associated with hyperthyroidism and some cases of pituitary dysfunction or prolonged malnutrition. What you really need to know is that TSH, in combination with other thyroid function analytes, is going to provide a clear picture of thyroid function. And it's important to remember that free T3 and free T4 are the active hormones, which I mentioned are included in this panel to give you a complete look at thyroid function. Next is vitamin D. And as you know, vitamin D, it's important for calcium absorption, but it also has received widespread attention for its potential role in preventing cardiovascular disease, type 2 diabetes, and as an immune system regulator. As it relates to thyroid function, low vitamin D status and autoimmune thyroid diseases such as Hashimoto's thyroiditis and Graves' disease had been reported, as well as impaired vitamin D signaling in thyroid cancers. So it's important to know the patient's vitamin D status. And finally, as part of this panel is a comprehensive urinalysis with microscopic examination. Now, a urinalysis that's going to be an important tool for assessing the chemical constituents of the urine and the relationship to various disease states, such as urinary tract infections, diabetes, and kidney function. And the microscopic examination, that's going to detect the presence of abnormal cells and other formed elements. Next is the Evexia Diagnostics Comprehensive Thyroid Panel. So aside from containing the analytes that I just mentioned that are included in the complete thyroid panel, this panel adds on an additional 4 biomarkers pertinent to thyroid function, and you see them listed on the slide. There's the F2 isoprostane creatinine ratio, iodine, thyrotropin receptor antibody, and thyroxine binding globulin. Now let's start with the F2 isoprostanes. So what are these things? The F2 isoprostanes are produced in conditions that result from excessive generation of free radicals produced in the body that are going to cause oxidative stress. So since the thyroid hormones are involved in the body's metabolism, it's important to assess for oxidative stress, which can cause tissue damage, by the way, including the thyroid gland. So you need to know if the patient is experiencing oxidative stress, essentially because it can damage the thyroid gland. Next is iodine. Now, this test is used to determine serum iodine level, as well as for monitoring iodine therapy. Essentially, this test evaluates for iodine deficiency disorders, excessive iodine intake, or iodine exposure in the workplace. And remember that iodine is contained in both thyroid hormones, and a low iodine state is associated with thyroid hypofunction. Next is an analyte called thyrotropin receptor antibody. Now, this analyte is an autoantibody to the thyroid gland receptor for the thyroid stimulating hormone. And it's been demonstrated in 90% of patients with Graves' disease, meaning hyperthyroidism. The next analyte is called thyroxine binding globulin. Now, this analyte is a major thyroid hormone protein carrier and is helpful in evaluating individuals with an abnormal total T4 and T3 level. Now, this carrier, thyroid binding globulin, can be increased by the use of estrogens, tamoxifen, pregnancy, and in some cases of liver disease, including hepatitis. Now, a decrease in this thyroid hormone protein carrier can be found in such conditions as chronic liver disease, kidney disease, and systemic disease. So essentially, abnormal levels of this thyroid hormone carrier will influence thyroid hormone function in the body that can be causing abnormal metabolism. Next is the Evexia Diagnostic Premier Thyroid Panel, and that's going to provide a broad spectrum look at thyroid hormone production and metabolism, as well as general health. This panel includes 5 additional analytes added to the comprehensive thyroid panel, and they're outlined on the slide. Coenzyme Q10, glutathione, heavy metal profile, selenium, and RBC zinc. Now, in regard to coenzyme Q10, now you may know that this also referred to as ubiquinone because it is found in nearly all cells of the body. And coenzyme Q10 plays an important role in ATP production, or essentially energy production. So if there's a deficiency in coenzyme Q10, fatigue may set in, which may be similar to the symptoms of hypothyroidism. And I also want you to remember that statin drugs will lower the level of this important nutrient. Next is glutathione. Now, glutathione is a tripeptide and is the primary regulator of cellular redox states. Glutathione serves as a cofactor for several antioxidant enzymes. It helps regenerate vitamin C and E. It neutralizes free radicals produced by phase 1 and phase 2 detoxification and is involved in the transport of mercury out of the cells, including the brain. Next is the heavy metal profile 1 that includes the analytes arsenic, lead, and mercury. Now, I'm sure you may know that heavy metals are abundant in the environment, but certain heavy metals can damage the thyroid gland. And this test is going to take a look at those particular metals. And as you probably know, zinc and selenium are essential trace elements involved in thyroid hormone production, which I alluded to earlier. Now, selenium supports normal thyroid function and is necessary for converting the thyroid hormone T4 to the active thyroid hormone T3. And by the way, selenium also plays a role in antioxidant function in the body, so it's important to take a look at this. And finally, zinc. This panel takes a look at the zinc level in the red blood cell. Now, zinc is critical for proper thyroid metabolism, and a zinc deficiency can result in decreased thyroid hormone levels as well as a decrease in the resting metabolic rate. And please remember that a zinc deficient individual tends to have immune system dysfunction.
Thank you for that valuable insight, Dr. Sedano. We will now briefly review where to locate the ready-to-run Evexia Diagnostics panels. When you log into your Evexia account, you are automatically taken to the dashboard. From here, click on the Test Menu tab at the top of the page. You will then be directed to the Evexia Diagnostics test directory. Although you can enter Evexia into the keyword search box, you can simply click the quick link labeled Evexia Panels under the Featured Panels and Tests column on the right, which will bring you to the different categories of ready-to-run Evexia panels. At the top of each category page, this helpful resource provides a general overall description of why the testing is important, followed by the list of available panels in the category. Scrolling further down the page is a comparison chart. Each panel from the category is listed at the top and can be clicked to be taken directly to a detailed information page specific to that panel. Moving from left to right, you will notice the panels become more comprehensive and encompass greater clinical insight. Test biomarkers are listed in the left-hand column, allowing you to see a breakdown of the analytes included in each panel. These are also clickable links that will take you to informational pages for each biomarker. These pages provide easy access to more specific details like the turnaround time, CPT codes, specimen type, stability, and an overview of the test. If applicable, individual analytes are also listed under the Components tab below the test name, and any particular instructions are listed under the Collection Details tab. Now let's briefly review how to order these panels. First, log into your Evexia account and click on the Evexia link option under the column labeled Quick Links on the left-hand side of the dashboard. Next, find your desired patient or create a new patient. Then, click the button labeled Add New Order to open the test menu and select the appropriate panel or test. Add it to the cart by simply clicking the plus sign on the left-hand side. Finally, preview and confirm your order once it has been added to your cart and complete the process by clicking the Place Order button. You can reach us during our extended business hours between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, by calling 888-852-2723, or contact us anytime via email at info@evexiadiagnostics.com. We are always happy to assist you with any needs or questions that you may have. Thank you again for joining us for this presentation. Until next time, from everyone at Evexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.